Stefan, the floor is yours. Thank you very much for being with us.
Thank you so much, Martin. Very warm welcome to all the participants on this special Medicus Mundi Symposium, Health in a Digital Age, and we deliver it digitally. My first experience in digital health was actually in 2005. This was after the devastating Asian tsunami, when I was leading in Aceh in Indonesia a mobile health innovation that addressed the issue that due to the earthquake and the flood from the tsunami, probably half of the midwives in Aceh province died in this disaster. And there was an urgent need to upskill new midwives, and a mobile technology solution in a consortium that brought together telecoms provider in Indonesia, digital providers, mobile phone providers, as well as academia from universities in Singapore. Now, a lot has happened since then. In 2005, when there were sort of the first sort of digital health solutions within the sort of health and development space moving forward. A lot of positive things have been said, written, and shared, and a lot has been sort of highlighted on all the opportunities that we actually have. But as Martin said, I am an optimist, but increasingly actually I'm looking very much as well at the risk side of it, and hence the presentation that I'm giving today actually starts with the word risk and then looks at the opportunities. Because I'm increasingly becoming very convinced that unless we collectively and urgently address some of the risks that we are facing linked to data and digitalization, we will not be able to leverage the opportunities in the long term for human health and well-being. So if we look at the context of universal health coverage and see the digitalization within the health space as a potential driver towards achieving these goals linked to the Sustainable Development Goals, then we collectively, urgently need to address some of the sort of risk and linked to issues of the highly unregulated landscape that we are facing ourselves in, specifically around health data governance. So I'm very glad that Medicus Mundi actually chose the topic health in a digital age and not digital health. We need collectively to reimagine health. We need to kind of rethink how health could be provided from a, what I would call inside-out perspective. That means we need to start with each individual person and what the digitalization of our own personal life means, and then move it from a patient or individual citizen's perspective into what this means for providers within the health system. Today's digital health is largely unregulated. We lack adherence to human rights issues, and this is of grave danger to humanity. We've seen it at the pre-session of this conference, on this symposium, with the Slido response, how critical issues are around human rights and other sort of concerns related to privacy. We've seen it as well in the address from the Federal Councillor, how important ethical questions are and human rights questions. I would like to encourage you strongly to watch a Netflix documentary / feature movie called The Social Dilemma. The social dilemma really gets at the core of the manipulation at large scale that's happening currently within the digital spaces, and how rapidly we've moved into what some call the surveillance capitalism that's driven largely by big global tech companies. I would like to make reference as well to a report by the UN Special Rapporteur on Extreme Poverty and Human Rights. Philip Alston wrote last year to the UN General Assembly a report which is entitled The Digital Welfare State. And I would like to read a few critical quotes that he brings up to frame sort of the discussions that we might have during the day. I quote from Philip Alston's report. As humankind moves, perhaps inexorably towards the digital welfare future, it needs to alter course significantly and rapidly to avoid stumbling zombie-like into a digital welfare dystopia. End of quote. There is enormous risk that as we push at a government level into sort of really digital solutions within our welfare state, be that in the welfare provision, in health or education, that we are actually rapidly moving into surveillance state. The surveillance state combined with the sort of surveillance capitalism is creating sort of a control system that really kind of needs to be addressed, because what we are moving on into a state where government and the state is starting to keep citizens accountable rather than actually citizens keeping the state accountable. He has in his report some other sort of critical element. One is a statement he made that empowering governments in countries with significant rules of law deficiencies and endowing them with the level of control these digital solutions and biometrics actually bring, that is sending us to shudder down the spine of everyone, even vaguely concerned to ensure that the digital age will be a human rights friendly one. So let me give you now a few examples that we are working on as a foundation. We basically have worked with a provider called Ada Health. And within Ada, if you can go back, thank you. This is the world's first sort of AI-enabled diagnostic tools in Swahili that was launched last year. It gives access to, eventually, there's about 100 million people speaking that language, to top of the sort of range, high quality diagnostics using AI at the back end. We have as well supported EPFL recently in the privacy protecting proximity tracing for the back end sort of technology that is used in the Corona app. Next slide. If we sort of look then at the convergence that is driving this, it's really sort of the big data that is becoming available rapidly from wearables, from diagnostic tools, from clinical data, from even environmental data. And then we have increasingly powerful algorithms. At the same time, we have increasing computing power. So there is unprecedented potential that actually can be leveraged for prediction, decision making, and we can actually have the potential to move forward into a much more sort of preventative, data-driven health provision. Now, these are sort of really the tremendous upside, but unless we address some of the underlying issues that I mentioned in my introduction, we will not be able to leverage that. Next slide. So as a result, as a foundation, 2 years ago, we brought together the Financial Times and the Lancet and brought a commission forward that really looks at governing digital health ecosystems in the context of 2030. That really looks at acknowledging that today digital health unfolds largely in an unregulated landscape. We lack political, legal, and governance frameworks. And unless we address this urgently, collectively, and move this forward, we really are not able to harness its full potential. Next slide. In parallel, together with actually Medicus Mundi, Farm Access, PMNCH, Women Deliver, PATH, and others, we are launching currently the Transform Health Coalition. That is a 10-year sort of global campaign that will support the findings of the Financial Times and Lancet Commission over the next 10 years in a sustained effort to really look at 3 key objectives. It's to recognize the fundamental role that digital technologies and data have within the transformation of health systems towards universal health coverage by 2030. The second key objective is a legally binding international health data governance framework to provide protection and reduce risk. And third is to increase the domestic and international financing for the commitments to strengthen digital solutions within health systems and empowered communities. I'm coming now to sort of my conclusion. As I sort of mentioned, there is urgent need to address some of the issues that I've brought up linked to the lack of human rights principles and lack of data governance and digital governance among key actors. I do think that Switzerland is extremely well positioned with its sort of strong rule of law, with its tradition of human rights, and as well with its local sort of position in the global context of key global health actors like the World Health Organization and others. I think we have currently a great opportunity that in the context of the corona pandemic, there is a work stream globally happening to review some key elements of the international health regulation that is an international health law from 2005. And we might need to advocate there to have an annex in this international health regulation moving forward that really deals with some of the corona and other sort of health regulating, international health regulation specific issues, to have an annex on data governance and digital health. This is sort of a low-hanging fruit that collectively we could push, and I hope that Switzerland and other member states together with civil society would push for something like this as we look at the international health regulation currently. The other element that Swiss civil society actors who work in global health really could do is to encourage that ourselves in all the planning and deployment of data-driven and digital solutions that we are conducting human rights impact assessments all along the way. So we should encourage governments to really drive on human rights impact assessments before any digital data solutions are moved forward. We as well collectively could have an increasing dialogue what actually does privacy means in a digital age. And last and not least, I think we collectively should work towards a possible global framework convention or an international health data regulation as a global binding under international health law, sort of that gives us the digital rights within the health space. Thank you so much.
Here I am. Thank you very much, Stefan, for your presentation, for your reflections. You can stay a little bit with us still, Stefan. Don't run away. Stay on the floor, please. Thank you, Mario. Because we will have a short time for some questions from the floor. You just put these questions into the chat now, and I try to grab them. And of course, we will have more time afterwards to discuss with Stefan as well for our final panel. I think what was interesting for me as well, you are really an optimistic person. You remain an optimistic person. You clearly declared where the risks are. But I think there is a link as well to what the Foreign Minister, Ignacio Cassis, our Federal Councillor, has said about human rights issue, data protection, and the role Switzerland could play. So having heard Ignacio Cassis this morning, Stefan, you think we are on a good track that Switzerland could take over this role, or where do you see the challenges and the gaps within Swiss policy?
I think Switzerland is in a good position. There are several factors that are sort of enabling it. One is actually that we are sort of like, 27 sort of like governments in terms of ministries of health. And we sort of in a micro level need to figure out how can we actually harness the power of data across the different cantonal borders. And their sort of technology is increasingly starting to help us. That's no longer needed to sort of pool data, which is quite often problematic given the sort of sovereignty of states and concerns about citizen status. But like EPFL and ETH Zurich and many others are working on new AI-enabled technologies called data federated learning is one sort of strand, and the other one is split learning, which basically makes it that in the end of the day, we could probably all have our health data on our phone, and we have as citizens control. And these algorithms can actually basically travel and make use for what is of interest collectively in terms of getting just snippets of vector of the data to make sense at the big collective level without actually infringing on my privacy. So they are sort of increasing technological advances, and Switzerland is very much at the forefront on this. Secondly is we have been supporting together with the Wellcome Trust and others, and the Graduate Institute is hosting that together with the Geneva Science and Diplomacy Anticipator Foundation that actually our federal counselor, Gassis, has been instrumental of setting up. But 3 weeks ago, there was the launch of the incubator of the International AI and Health Research Collaborative. The aim is within the next 2 years to launch out of Switzerland an international AI for health research collaborative that collectively will tackle some of these big issues that we are sort of facing from not only a technological point of view, but as well looking at what are the governance issues, what are the ethical issues, what are the human rights issues. It's inspired a bit by the CERN idea in terms of nuclear science. How can we pool all government resources together in science and technology research, and then basically leverage that for the global sort of health public good.
Thank you.
So that's one aspect. Maybe this sort of slide.
Yeah. Sorry, because there's really now many questions coming in. So we will continue on this discussion, Stefan, as well on the panel, because very important points. There is one question, a quite basic one. You have talked about human rights assessments. Someone on the floor asked, could you tell us more around this human rights assessment, what you have meant with it?
Yeah. So the Office of the High Commission on Human Rights, they actually have a small team that is working on digital rights and engagement, both with the private sector, and I see there's another question in terms of the private sector, the big tech engagement. And so they are sort of human rights assessment tools that have been used for other programs. They have not been widely used that much in the digital space, but it's basically when you have an ID, up to the time you deploy it in its full sort of development, research and development of your ID, till you deploy that digital ID, you kind of really need to have a deep understanding what are the potential human rights implications of that solution. And so that's what I would call there is need for increasingly human rights assessments. And so, one thing maybe Switzerland's sort of Medicus Mundi could take up on is to map what are the existing sort of human rights assessment that have been done and have like a toolkit for digital within the health space and digital. I know Effie Vaiena, ETH Zurich professor on health data and ethics. They have done quite a lot of thinking and done quite a bit of assessment around these issues. Amnesty International, they have what is called Amnesty Tech, and that's a really vibrant group that started to dig deep into some of the issues around human rights sort of impact assessments at government level before a government deploys on a national level a digital solution.
There is a last question maybe before we hand over, quite a practical one. How do you see that digital health transformation is impacting the more traditional approaches in public health of NGOs and other organisms of global health universe? But I think this is a topic that we were, during this year, as Medicus Mundi Switzerland, worked with our member organizations on this topic, came up quite a lot. How is it linked, impacting the traditional approaches of public health?
I would like to sort of start with one quote. That's not my quote, but basically AI is not going to replace doctors, but AI or nurses or most people in the health sector, but AI is replacing those who are not using AI. So it's really how can we, let's not forget, digital and AI and data are tools. They are sort of not an end in itself. And so we kind of need the challenge is how can we move in our thinking? Most of us are still very much in an analog sort of trained world, and we have an analog mindset actually in terms of the way we look at things. And the challenge is how can we really embrace what we do and what we do well, but within the context of the digital world. And it's really about enhancing quality. It's enhancing the experience of citizens in the prevention space and patients when they need care and support, and really sort of transform it from what I said is inside out. Let's look at it from an individual person's journey, and then at the community level, and where does digital really adds value and where not. And I think that's a big challenge quite often is that we don't really have much data on where does digital really significantly add value. And so there's a risk that we divert resources into digital when more traditional approaches actually would be much more beneficial. So it's therefore not be overexcited on digital solutions, but actually ask the question, is it really making the situation better for individuals and communities where you operate? And only when you're sure that it actually does, then it's worth investing into digital solutions. But that's why the title of today, it is Health in a Digital Age. Always be conscious that the situations have changed. We are now in a digital society.